Okay, I see some folks are still coming in. I think we'll go ahead and start with our introduction, and then I'll hand it over to our team that you are here to hear from today. So my name is Carrington Lott. I'm the program manager at Systems for Action, and this is a bi-weekly research and progress webinar series where we have our research that is funded to do systems alignment research come and provide you with some updates on their findings and progress as their research projects progress. And today we have some special guests joining us from the Georgia Health Policy Center who are going to be talking about their measurement toolkit for cross-systems alignment. And these are some of our colleagues. They're not funded by Systems for Action, but they're colleagues that are also engaged in systems alignment research. And I think they're going to have some really interesting things to share with you. So the presentation name today is TEAM. It stands for a toolkit for everyone aligning and measuring. And Daniel will be presenting today, and he will tell you a little bit more about that. And I believe they'll even walk you through their toolkit, so you'll get to see that with your very own eyes. So you're hearing from me right now. I'll give Daniel a little intro, and then I'll hand it over to him so that he can tell you more about their toolkit. And then at the end of today's session, we will reserve some time for questions and answers. So if any questions come up at any point during today's webinar, make sure you access the Q&A feature at the bottom of your Zoom screen and put your question in, and we'll make sure that we address that at the very end of today's session. And today's session is being recorded, and we will share today's slides after today's session. So you will definitely have access to those. So with that, we'll be hearing from Daniel Lanford, who is a senior research associate at the Georgia Health Policy Center. And he also works as a member of the team on the Robert Wood Johnson Foundation's Aligning Systems for Health initiative, where he works on compiling and evaluating existing research on the alignment of public health, healthcare, and social service systems. So with that, Daniel, I'm going to stop sharing my screen so that Eliza can share her screen and you can get started on your presentation.
Okay. Well, thank you so much, Carrington, for the introduction. Hello and welcome, everybody. Thanks for being here today. My name is Daniel Lanford. I'm a senior research associate at the Georgia Health Policy Center and the Andrew Young School of Policy Studies at Georgia State University. I'm a sociologist. I got a background in policy, collaboration, federal funding, and of course, public health. So again, thanks for being here. We're going to make it worth your while. Thanks also, again, to the Systems for Action team, always an incredible partner in the work, especially with the Robert Wood Johnson Foundation Aligning Systems for Health. Thank you for the invitation to be here. Thanks also to the system. Today we'll be talking about the measurement system that came out of Aligning Systems for Health, the toolkit for aligning and measuring. And as Carrington said, we're actually going to be digging into it at some point today. Everyone's going to have a chance to do that. Before I go on, I'm presenting on behalf of a team at the center and, well, really at the center and beyond that worked on this measurement system. So thank you to everybody, maybe even some folks in the audience if you've been a part of Aligning Systems for Health. So thank you. And thanks especially to Eliza Pedawala, rising star at the center here for work in SUD and health collaboratives and community voice. She recently created and presented an early version of this presentation for the National Network of Public Health Institutes. We had a great reception. So if you see anything crazy here, it's probably because I changed something, but thank you, Eliza, for that. Now, before I proceed, there is word coming into me that there might be a very loud echo in the volume, and I'm just wondering if that is a widespread issue. That sort of thing can be caused by maybe if there's the computer and a telephone on. I don't know. Okay, resolved. Thank you so much, everybody. All right, well then, let's jump into it. You know a little bit about me. I want to know about you. Let's get to know each other a little bit here in the chat. I want to know if you have worked with a collaborative, and likely if you're here, you've worked with a collaborative, at least in some sense, in some capacity, especially one that spans sectors. And I mean that in the broadest sense of the word, any way you might construe a sector, any way you might construe a collaborative. I'm interested in what were those sectors, what were those organizations, what was their background, what were those sectors? If you could put that in the chat box, we'll get to know each other a little bit. All right, we've already got material out here coming in. Fantastic. I'm just going to give folks a second. I can give my own example. thinking about the Atlanta Regional Collaborative for Health Improvement here in Atlanta. We've got hospitals, they've got us, public health, they've got community-based organizations, social services, runs a pretty wide gamut. Fantastic. All right, now while you're putting that into the text box, go ahead and do that. But there's a follow-up to this one. Okay. Should be a question too that pops up if we go to the next slide. All right. I want to think about data and measurement today, and there are a lot of different ways to think about data and measurement, and we'll get to that. There are risks with it, to be sure. There are great opportunities, but I want to go ahead and get in the mindset of thinking what data has been important to us in the past. And I'm not necessarily talking about statistics or formal data or anything like that. I'm talking about maybe even a conversation you had with somebody, just something that really seemed important for that collaborative you worked with. And it might be the one you just talked about. All right, emergency department utilization. At Archie, for me, it was when they talked about the housing disparities in Atlanta, especially the black-white housing disparities, and how the unjustly marginalized folks of Atlanta had limited access to housing and how that affected their health. And just to see those numbers on the differences in housing and wealth that was going into later health outcomes really was interesting, and I know motivated a lot of work with Archie. All right, thanks a bunch. That really helps. We know each other a little bit. We've got a lot of material in here, a lot of people working on a lot of different things, so I guess we were in the right place. Okay, let's move on for now. We'll get back to some of that. Let's move on for now and talk about what to expect for today. We want to talk a little bit about the team's origins, and a lot of this, I think, is going to be familiar to you. So we're going to move right on through it, and but we're going to have the chat going. We're going to have the Q&A. So if you've got questions, we need to back up a little bit. We can definitely get to that. Please post that. But hopefully this will resonate with your work. We're going to talk about what's inside the team. We're going to dive in. So if you're on a phone, that could be a little bit tricky. If you're at a computer, hopefully you'll be able to navigate alongside us, or even click around on your own. We'll get there. And then we're going to talk a little bit about next steps. And just the big thing that I want to highlight with this is that we're hoping this is a part of connecting people with each other, but also making this as useful as it can possibly be for others as well. And so that means iterating what the team is, as it continues to be used and fielded by more and more people, we're hopefully going to get feedback and we'll be able to make it more useful as we go on. Okay. So a little bit of background. We know health outcomes are not great in the US, especially for how much we spend on healthcare. Also, health outcomes aren't the same for everyone. Again, we've got all kind of marginalized populations that have far worse health outcomes than other groups in our societies. We've got, black-white divides. We've got Native Americans versus non-Native Americans. There's all these different divides, and you can see stratification of health outcomes pretty starkly across those divides. And that's for a lot of reasons we're going to get into, of course. Racism, the structural racism that's baked into these systems, and that's something we hopefully will address. But there are a lot of things that go into health in addition to healthcare. Healthcare definitely matters, but a lot of things that go into that, and that brings us to the next point. While healthcare is important, there's increasing recognition of these other factors, especially in relation to the social determinants of health. And we've probably at this point, everybody's heard of that, but if not, we're talking about the environment in which people live their lives. They grow up, they live their lives, the resources that people have to negotiate, the challenges that they experience in life, those sorts of things that are associated with social status, social power, that sort of thing. Social dynamics, political economy, those sorts of things. All right, so given the concern for social determinants of health, and there is a movement towards, okay, so how do we get health and entities that deal with these social determinants of health working together? How do we coordinate care and prevention inside healthcare and beyond healthcare? How do we bring money to bear on the social determinants of health? There's a lot of money in healthcare, right? So, and there's money, and there's money everywhere, but like, how do we sort of balance out where we've got the money that's coming in new and creative ways into addressing the social determinants of health? So there's a lot of things you can do with collaboration. Those are a couple of things that people do. There are many more. Maybe you can think of some examples. So this is the context we've been living in for at least 20 years, since the World Health Organization published their paper in 2003 on the social determinants of health. Many people have been working in this space and from this mindset and philosophy for much longer than that. But there's been increasing interest in this space. RWJF, the Robert Wood Johnson Foundation, has observed this. They've been present in this space for quite some time, supporting research and practice in this space and collaboration. But they've observed a couple things. A lot of the collaboratives are short-term, and sometimes the progress is not what we might expect or hope for, right? So how do we get to where we're actually changing systems, these collaboratives become linkages that last, and how do we make changes that are observable, that are real, that can actually affect the health in this nation, which we started out noting was kind of not where we would want it to be right now. And so, observing this, the Robert Wood Johnson Foundation created Aligning Systems for Health. And the Georgia Health Policy Center has been the coordinating office for this work, but lots of other people have been involved. S4A, maybe you've been involved. The idea is to promote structured thinking about and advance the practice of cross-sector health collaboration, and ultimately help people achieve their desired outcomes, better health, that sort of thing. So to help people think in a structured way about health collaboratives, the Robert Wood Johnson Foundation, the Georgia Health Policy Center, and many other people have been developing a model for key considerations in health collaboratives. And that brings us to the framework for aligning sectors, which, again, many of you may have seen before. If not, there are just a couple items I want to point out. On the left side, you see that there are multiple sectors that are understood to be that you might want to think about having involved when you want to get to these outcomes that are over on the far right. You've got public health, healthcare, social services. This doesn't mean you can't think about other organizations, but at the very least, it's probably worth thinking beyond, of course, right? Like we said earlier, just healthcare. How are those social services affecting the social determinants of health? How does public health think about this in holistic terms? In the middle, you see a box, and it contains a number of things. One, you'll see big round gears, the things that say shared purpose, data, governance, financing. These are important activities for collaboratives to think about, these sort of structures or processes that we find time and again when we're doing our work with aligning systems for health that people are mentioning, when we're doing our reviews, when we're having our interviews, when we're talking with folks, when we're having big meetings. These seem to be the things that people are really interested in. In addition to these other terms you see floating around inside that box, these factors, these other factors that consider that we've been calling them the adaptive factors, but community voices, equity, trust, and the power dynamics that tie it all together. It seems that these things must be first and foremost if you want to get to things in the end, like meeting communities' goals and needs. So there on the right side, you have your intermediate outcomes, mindset, practice, policy changes, and the sort of distal outcomes, community goals and needs, health equity, racial equity, which are the objectives that this framework is centered around. Okay. So we have aligning systems for health, and we have the framework for aligning sectors that gives people a structured way of thinking about this. In our time, and it's been several years now that we've been working in this space, there are things that we have observed. First of all, there are a lot of people involved in this space. As we can see in our chat here, a lot of people doing health collaboratives, working with a lot of different entities, right? Lots of folks are involved, have different perspectives. There's no shortage of ideas on how to do things, tons of experiences. How we make sense of it systematically is kind of an open question right now. The Georgia Health Policy Center has done a whole bunch of work reviewing research. Maybe we've read a paper from your organization at this point. But we observed that there are a lot of people coming at this from different angles. And so a lot has been going into what we've been learning in this time. And again, there's been a call for, okay, right. So there's been concurrent events, COVID, Black Lives Matter 2.0 that emerged in 2020. So there's this new cultural space. There's this new way of talking about things. There are new opportunities where we get to talk about things that were very difficult to talk about before, but we're in a new environment where we're able to do that a little bit more openly now. Okay, There's also the need for community leadership, right? Systems change efforts have sort of to this point had a disappointing impact. And one of the theories that's behind that is that, or that potentially explains that, is that systems are kind of having a hard time changing themselves. They haven't always done a great job at connecting with folks who have the lived experience, and they could really use those voices of the folks with lived experience if they want to make actual change. They could perhaps even follow the folks in the community, and that's an idea that folks are kind of trying to wrap their heads around now. I mean, some people have been in that space for a long time again, but to actually empower community leadership is something a lot of folks are calling for. And then, of course, the need to challenge racism. Like I said, there are exciting new opportunities to do that. Many ways to address this. The theory behind this that we're kind of hearing, bring it out into the open, challenge it, dismantle its roots, right? Whether interpersonally or through systematic change that makes it less easy to allow the unjustly marginalized to fall through the cracks of care and prevention. So we don't have these inequalities that we've had in the past. All right, and so the idea is that we must see this racism and the structures that allow it. And cross-sector collaboration helps us do that. It helps us see this. In the language of one of my colleagues, Japre Hemming, fragmentation obscures, and it obscures structural racism. You bring all this out into the open, and it can no longer be obscured so easily. So there's also the need for specifics, right? We get a lot of questions. How do we work together? How do we know how we're doing? Are we aligning? How do we learn across contexts, right? So there are a lot of folks that are learning in their own individual spaces, but geez, when you think about how many other folks in the chat have been doing probably very similar work, how do we take the learning from one space so we don't have to learn the hard way, everything the hard way? So these are the things we've observed. Okay. So we've got the framework for aligning sectors, and then the challenge and the second round bullet down here is, so how do we take what we've observed working with the framework for aligning sectors? And the idea is that we come up with a measurement system for reflecting on the collaboratives, on health collaboratives specifically. It does things like bring all those ideas together that lots of different people are working from. It meets different measurement and strategy needs for different people. It promotes community leadership and helps challenge structural racism. It is intended and designed to do that. And it gets very specific. Or at least it moves the ideal is that it moves the field to a more specificity where you can communicate with people across the field more clearly. And that's what we have the team for. So that's the background. That's what's bringing us here to it. Now, let's dive in. Okay. Well, I do want to talk a little bit about it before we start clicking around. But if we go to the next slide, we'll see what we're about to get into. All right. We have four big parts of the framework for aligning sectors. I'm sorry, of the team. And you've now got a link if you want to go ahead and start clicking in, but I'll give you a little introduction. There are a couple things I want to talk about this. First of all, each tool refers to the framework for aligning sectors and helps people understand what is happening in relation to each element of the framework for aligning sectors. So that framework that we saw earlier, it's still here. The base set, featured set, group assessment, compendium, we'll talk about what these are, but they all reference back to that framework. So it's they help you think about those elements from different angles. All right, so just as a quick review, I'll start here at the bottom, the compendium, and we'll get into the compendium in a minute. But this was really one of the first things that we created. As we were doing our work with Aligning Systems for Health and getting all this information on health collaboratives from across the country, we decided when we were starting to think about a measurement system, we need to collect and gather all the measurement tools, resources, and the measures themselves into a specific space. And this eventually became the compendium. And now we're providing this to other folks. You can search, you can index, you can filter on a number of different dimensions. It's essentially a spreadsheet, all the tools and the measures that fit those dimensions that you filter or search on. It's all there. So you've got that, and hopefully you can help us add to that. Of course, we were also getting that question of how do we know if we're aligning or not, right? This is kind of like a specific way of going about health collaboratives. How do we know if we're doing that or not? So we thought about everything we've done. We thought about the measures and the tools in the compendium, and we came up with a very brief set of reflection questions to help people figure out if they are aligning in a formal sense. It's a short list of questions. They're yes/no questions. They're designed to be easy to answer. It doesn't necessarily mean you're doing a good job or a bad job, but like, is your mind in this space? Are we aligning here? That's what the base set is for. Now, of course, a lot of folks are going to be interested not just in are they doing work that reflects that framework, but like, are they following those suggestions that might be considered good practice? There have been a lot of people doing practice in health collaboratives and specifically in these areas of the framework for aligning sectors. And so at this point, we've got some ideas on what might be a good thing to think about. And so we put those all into the featured set of questions. There are a featured set of questions that people can ask about to reflect deeply on their collaborative. For each element of the framework for aligning sectors, you can think about, well, are we doing these things that it seems like might be tied to success, or we might at least want to think about? They might shape what our next move is, right? So that's all in the featured set. It's over 200 items. You could use them as survey questions. We also indicate where you might be able to collect documents, or think about how your documents could be updated or changed to reflect some of these suggestions from the field. They're embodied in the featured set. And of course, it's coded, it's organized in such a way you'll see that there is a section for each element of the framework for aligning sectors, but it's also coded when the items are relevant to other sectors, when there's like a cross-coding to do. That's kind of abstract. We'll get into that. Finally, the group assessment. I wanted to just talk about that for a second. This is based on a tool called the ACTS tool that the Georgia Health Policy Center is creating right now, but it's focused on the framework for aligning sectors. What this is, it's an activity. It's basically an activity. It comes with instructions in a worksheet. And on the worksheet, there are questions about each element in the framework for aligning sectors that are there for folks to answer, but there's a method for going about it. And the idea is that you gather together your community, the leaders that are going to be involved in this, whether they're from the community residents or fit some description, or they are part of the sectors, professionals in the sectors that might be involved in the collaborative. You get everybody in the same room, or you have them all fill out that worksheet. They all fill out that worksheet. You get them all in the same room after that, and you say, okay, well, what did you get on this? What did you say? How did you describe our efforts at developing shared purpose? How did you describe our efforts at shared finance? And it's a way of getting everybody in that space to, first off, share their starting points, but also come to consensus so that that collaborative has an idea of where it is and where it might want to go next. So it's almost like a team building experience, but it also could be used for a lot of other purposes that involve deciding collaboratively where you feel like you are. So that's another tool that we provided there. A couple other things I want to say before we dive in. You've got me here chatting, but we're not going to leave you hanging after that. We've got lots of guidance. We have general guidance, and each of these 4 parts has guidance of its own. You will see that when we dive in. The short version is you can use this information however you like. I mean, it's publicly available. It's out there. It's ready to use. Take an ethical approach, but we've got suggestions for how you might make the most of it. So there's tons of guidance. Also, we think of, if we could go just, I've still got a couple more thoughts before we dive right in, and that is on roles. As we have seen, there are a lot of different people in different collaboratives in this space. And I imagine lots of folks here have different roles. It's very easy to look at measurement from only our role. Like, for example, I tend to do a lot of research. It's very easy for me to get lost in the research element. But there are other folks involved, right? There are members of the community. There are program evaluators. There are funders involved. Like, how are they going to use this? There are the practitioners. There's lots of different folks. And so we've tried to look at everything in the team through the lens of how different types of users might approach it. And so we've got guidance on how you might think of your role, and then how you might be thinking about how you might want to use the team. Sorry. And we'll get into that a little bit more, but I just wanted to prep that before we got into it. In also this, I want to say this. I'll just give a couple examples, right? To make it concrete. Suppose you're a practitioner, right? You're herding cats. There's a big organization. You'd propose to the room, what if we all came together and developed a shared language about what we're doing? Well, in that case, you might want the group assessment for aligning systems for people to grasp, because that's going to give everybody an opportunity to sit down and go through a structured exercise to sort of come to agreement on how they're doing on all these different measures that people consider important. Suppose you're a funder, that you're looking for certain things that you want people in your next round of funding to be able to think about. You could go to the featured set and look under an area that seems important to you, say shared finance and say, all right, well, what are the items that other folks seem to say are important? We might want to put that in our RFP or something along those lines. Suppose you're a community member. You might go into the featured set and say, hey, I think it's really important that we hold our institutional partners accountable for certain items that have been recommended in the past. That might work for you in the featured set. You could go find that sort of thing. You might say, well, I'm not seeing what I want here in the featured set. You could go to the compendium. You could go to the compendium and see if there is another measure that somebody has used in the past in a very similar situation. You could find that in the compendium. So it's all, that's just to get you thinking that this is all from a role perspective that we're hoping you'll be able to look at this. Okay, one other thing on roles before we go, if we could go to the next slide. We're hoping that everybody will be able to apply what is useful. Again, you don't have to, we've got structured approaches that you could use this through. But as long as it's useful, that's what matters. And I think hopefully the idea is that we'll start to learn as a field in a way that we haven't before about health collaboratives. We'll definitely learn about how useful the team itself is, right? And in either case, the idea is that folks will be able to share, and hopefully that's something that no matter what your role is, you'll be able to help us do. In fact, a diversity of perspectives would be super helpful, right? And so we'll talk about ways that you can do that we've kind of set up. Okay. So now is the time. Let's actually roll our sleeves up, dive in. The URL is fairly simple. It's measuringaligning.org. And you can type that into your browser. I'm gonna, Elise and I are gonna walk you through this, but if you want to do it independently in a second window, you are more than welcome to do that. I'm just gonna give everybody a second to do that now. And Elisa, if you want to go ahead and transition over to the website, I think now would be a good time. Feel free to go ahead and click around while you're in there. We're waiting to pull this up. It looks like we have it. So hopefully you are also seeing a fairly similar screen with information scrolling across the front. I'm going to walk you through it a little bit, and then you'll have another chance to kind of click around. Up in the top left, you'll see welcome to the team. That's always going to be visible on your screen. You can always click that and it will always bring you back to this home screen. There's a lot of stuff here on the home screen, so bear that in mind. If you get lost, you can always start over again at welcome to the team up in the top left. Now, if we scroll down a little bit further, we will see the 4 tools that I just described to you: the base set, the featured set, the grasp tool, and the compendium. So we can click on those to open those up and download those, but I don't want to do that just now. I want to keep scrolling down a little bit further. A little bit of introductory language is what you have here. And notice if you look closely, there are several links you can follow right there in that introductory material, including roles. You could click on that roles information that I told you might, we're going to get to that in a second. But if you want to go ahead and sneak preview that, you could do that here. If we scroll down a little bit further on the homepage, this is where we see the guides. And I told you there would be guidance here. This is the general guidance, things that are going to be useful pretty much for anybody taking a look at this. Now, of course, you don't have to look at all of it. Maybe some of it piques your interest more than other parts of it. But as we were putting this together, we thought these would be things that folks would be very interested in. If there are other questions, again, hopefully we'll be able to speak to those if you can offer feedback on that. But we'll dive a little bit into those in just a minute, but I want to scroll down just a little bit further. I keep saying we're all about feedback. There will be iterations, that sort of thing. This is a living tool. If you look at the bottom there, aligning@GSU, that is the email address to use. Hopefully we can remain in contact about your experience with this. We'd love to hear if you've got examples, if you've got questions, if you're interested in using part of this. The more we hear, the better. You don't have to, of course, obviously, but we're really excited about hearing from folks that have considered this in their context and what that experience is like and how we could be helpful with that. So I just wanted to point that out. Now, up at the top right, of the homepage. If we go all the way up, oh, there we are. It's already there. You'll see a couple questions, who it's for, what it offers. I guess they're not so much questions, but they're quick links to the guidance that you saw down at the bottom. So if you don't want to scroll all the way down, you can follow those quick links. Now, there is one piece of the guidance that I wanted to highlight. There's a couple pieces of the guidance that I wanted to highlight. If we could click on either why use it up near the top or down in the other guidance, why was the team created? There's, yes, here we go. Now, I don't want to be uncritical advocating people do data and measurement. I know that that is a hot topic. You know, I almost want to start out the presentation. I'm going to talk about the most controversial subject today. It's not the most controversial subject, but it is controversial. And that is how we use data. And so I think it's important to think about this and speak to this. And so that left button there, that left green button that says measurement risk, it talks about a couple risks that you might want to think about before you go into this. And we hope people will. I guess some of the themes that draw are the resource risk, right? Like you're probably already thinking in your head, like this is going to take time, this is going to take money. So how do you balance the resources available versus what you're trying to achieve? Something you're going to want to think about. Also, there's the misuse risk, right? Like what if we're not working with communities to develop our data plan? What if the community doesn't own their data? What if we come up with some findings that aren't what we were expected and some newspaper runs with it and, you know, we get smeared and the program gets canceled? You know, there are things that you want to be thinking about. We've also got some thoughts on how you might mitigate some of those risks. And also, as with many things in life, while there are risks, we wouldn't be here if we didn't think there were benefits. So if we can close that and then click the other green button, we've got a long list of people. Maybe you don't need motivation. Maybe somebody you work with could use a little bit of motivation. But if you just stop and think about all the things that this could help you do, it's going to give new ideas. It's going to help you anticipate challenges. It's going to help you build consensus in your collaborative. It might help you hold yourself or others accountability. There's a bunch of things, a big long list. So we just wanted to make sure we're letting folks know that we're thinking about that. You might have other ideas in addition to that, but I thought that was worth pointing out. Now, let's get back to the subject of roles. If we can go home and then into the introductory material, or even who it's for, that would be up top. Who it's for, that would be the place to go. That takes us to, if we could scroll down just a little bit, we'll see several green buttons there. Okay. So these are the roles that we really had in mind when we were working on the team. That seemed to be who we were working with most. You can click on any one of those roles and find out how we think it might be helpful for somebody in that role. So at this point in time, I'm going to ask two things in the chat. If you could maybe mention one of these roles that you've taken or the role that you had in that collaborative that you mentioned earlier. Maybe you are in multiple roles. It'd be interesting to see where the overlap is. So I encourage you to write that out in the chat. You know, me, I'm going to be somewhere as an evaluator or as a researcher. Probably those roles are more salient than practitioner, definitely funder. So I encourage everybody to do that. If you like, you can click on the button and go ahead and take a sneak peek at those ideas of how the team might be useful for you. But I just want to give everybody a second to do that. And I'm going to do it myself. Okay. Lots of practitioners. We've got people that organize across all five. Thanks, David. Susan, a fellow researcher. Okay, lots of practitioners, lots of researchers. All right. Please, by all means, continue to put that in there. That's going to give us a sense of who we're talking with today. That's very helpful. I want to think about the roles that are scrolling through the chat right now. And okay, so what do we got? We got a funder. We've got I'm seeing a lot of researchers and practitioners. Let's don the hat of a practitioner. Okay. And what is the use case of a practitioner? Why don't you click on the button there for us? Thank you. All right. So let's see. That second bullet there. They may also want to determine if their collaborative has the basic elements of an aligning effort as depicted in the framework for aligning sectors. Suppose somebody comes out with maybe RWJF comes out with a grant and you want to know, are we aligning? There are a lot of different ways to answer that question, but the base set could help. Let's go navigate to the base set and see what's actually in the base set. There's your guidance specific to the base set, and then you can actually download the tool itself. Okay, here we are. And if you scroll down just a little bit, you'll start to see all these elements from the framework. You've got your introductory guidance there. And if we keep on scrolling, you'll see elements that seem familiar from that framework for aligning sectors. And it's just going to have one or two yes, no questions for each one of these parts of the framework for aligning sectors. It's really simple. As you can see from the scroll bar, it's not a terribly long document. It won't take too long, but it'll give you a sense of where you are in relation to these concepts that folks consider important in the framework for aligning sectors. All right, thank you. Now, I saw also a lot of researchers out there, right? And I know from my experience as a researcher, I'm really interested in seeing across, taking one measure and saying, how is everybody doing on the same measure across and why? Maybe there's a different measure. You can correlate the two, or you could take a deep dive. Either way, you're going to want to know some things that people have considered super important. And while the base set gives you some yes, no questions, maybe I want more, maybe I've got time for more questions, or I want to go a little more in depth. In that case, I might want to go to the featured set. So can we navigate to the featured set now? Here we are, and it comes with its whole set of guidance, and then there's the featured set itself. Let's click on the featured set itself and just get a flavor for what we have here. Again, you're going to find sections. There's a table of contents here that you're going to find very useful there. So this is a much longer document than the base set. Say we're particularly interested in, I don't know, let's say adaptive powers, community voice. All right, adaptive factors, community voice. Here we are, and it snaps back down here. These are a number of considerations that people have suggested in our work over the past 3 years might be incredibly important for this. So here you go. Here you have it. They're basically all, it's more or less in a survey format. You don't have to use it as a survey, but there's an index number on the left. There's a text in the text column. There are suggested response options. There's also, you'll see over there, docs. Is this something that conventionally could be documented? Is this something that you might want to document in the future? You could look into this as a researcher. As a practitioner, you might want to update your documents to reflect this sort of thing. These are all options, and you'll see a cross code. There was a list of codes up at the top. So again, it's relevant to community voice. It's relevant to power, shared governance. And then you've got citations on the right side if you want to dig into the citations where this material was that inspired this material. Okay, and if you scroll down to the bottom, or actually scroll up a little bit, and we should see an option to return to the table of contents. So it's a big document, but hopefully it's not too difficult to navigate. Okay, so that is a couple of examples of how somebody with a given role might view the team and the various parts of it and think about how it could be useful to them. Now, I want to give everybody a chance to click around in this. So I'm just gonna moment of silence for 1 minute to click around in the team before we go back to the PowerPoint presentation. If you've got questions, go ahead and put them in the Q&A, go ahead and put them in the text, go ahead and write them down, because we are going to have a Q&A session. All right. Ethan, it would appear, is requesting a look into the group workshop. Why don't we just poke our heads in real quick to the graphs? We can afford to do that. All right, here we are. This is something you could print out, you could download, you could pass out to whoever it is, their instructions, how to set it up, how to proceed. And then you get down to the actual worksheet itself. And again, on the left, you'll see those will be those big gears. And then all those other little elements that were floating around the big gears, there are questions about those too on the white rows. And so you would go and fill this out as an individual, and then you would come together as a group and come up with a group score based on all the individual scores. And you could say, okay, well, this is how we feel like we're doing in this space. That seems to be important. And how's that going to affect our strategy going forward? All right, well, let's go back to the slides. There are a couple other things I wanted to talk about before we open it up. Okay, so we talked briefly about the kind of work that went into this, but I just wanted to, there are several people involved in this work. There are tons of people involved in this work. Several folks I cannot sleep at night without thinking about thanking them in a presentation like this. We had grantees, advisors, institutional partners, community partners, tons of folks involved. You can find out more about them on our website, our aligning page on the GHPC website. There's tons of information there if you want to go check that out, see the work of other folks. There are links for that. Lots of good folks helping us out with that. One of our partners, the Population Health Innovation Lab, Phil, I can't say enough about them. They already have developed a toolbox and a survey that touches on these elements of the framework that you could field today if you wanted to. It's shorter than the featured set, which could also be used as a survey, but it's succinct. And I highly suggest, strongly recommend everybody going to take a look at that toolbox. They also did qualitative interviews. They've got their interview guides out there. Very great work, and they've been fantastic partners throughout this work. I also wanted to highlight the Pathways Community Hub Institute. They have a health collaborative certification system. They have been incredibly helpful. Sarah Redding is leading that. And of course, John Hornbeek has been a fantastic partner for me. And of course, our book on Aligning Systems for Health 1.0 is dedicated to the late Mark Redding, who really helped get Aligning Systems for Health off the ground. And so we want to give them a shout out. And of course, the work at AIR on equity principles for data and health collaboratives has really inspired a lot of the work we've done, especially thinking about how we look through an equity lens when we're doing this. And many other folks. I would love to thank them all, but go to our website. You will be able to find some of the other folks who have been involved with this project. And I just want to say thank you to all, especially if you're out there in the audience right now. All right, let's go to the next slide. Next steps. Okay, so we've been working on a lot with Aligning Systems for Health at the Georgia Health Policy Center. There's related work. Every health collaborative has on their mind finance and funding, right? And so there is work that we've been doing. It's basically building a toolkit for thinking about financing and funding in a collaborative space. And you can find those resources. They are recently compiled and put in a super user-friendly website that you will see there on the screen, localwellnessfunds.org. That is amazing work that is definitely worth checking out, that I wanted to recommend. Also, we have emerging work. So again, funding important. We're living in a period where a lot of COVID relief funding is out there. Some of it's already been used, some of it's not been used. Some people are having an easy time using it. Some people are having a really hard time using it. We are working on helping people do that. And so I recommend navigating to the Funding Navigator Guide.org website, that we're putting new modules on that website all the time. But we're just kicking off that work now to help people navigate those funding opportunities, especially in the context of equity-oriented health collaboratives. Okay. This brings us to the end of our part of the presentation today, but I did, in addition to questions, I look forward to getting to the questions. I also just wanted to encourage everybody to reach out with feedback. We were so excited about hearing people's thoughts. We're at the beginning of a journey where we're putting this out into the world. We're using it ourselves. And the more feedback we get, the better. So there's my address. There's that aligning address again. Please don't hesitate. And with that, I think I'm going to pass it back to Carrington for the Q&A.
Yes, thank you, Daniel, and the Georgia Health Policy Center team. I know so much work has gone into this, and it's been a pleasure to get to see how this is all kind of culminated in your toolkit. It's really interesting to get to step through that together with you. So we have reached the Q&A portion. So if any questions have come up along the way, or as maybe you're continuing to click through the toolkit, please make sure that you enter your question into the Q&A box, and we'll address that here shortly. So I'm going to go ahead and hop into our first question, which comes from Richard Taylor about classification of organizations. So they want to know, how do you classify backbone organizations and those that provide backbone services for the coalition in your categories?
Thank you so much for that question, Richard. That is a fine question. It's something we've kicked around a bit, quite a bit ourselves. Many of us have been thinking about catalyst organizations, backbone organizations in the practitioner space, just because it's folks that are institutional professionals that may not have the lived experience in the communities, but definitely have like their binding and the capacity to bring these collaboratives together and help them move forward. So we've kind of more or less been thinking about them as in the practitioner. It is a quote unquote practitioner space. The definitions aren't all going to fit perfectly in every case, but that's kind of how we've tended to think about it. Although we also here at the center do backbone work all the time. We've got researchers, people that probably provide TA, do evaluators. So again, probably we're going to be crossing the boundaries of these roles, and it's not just practitioners or backbone organizations or catalysts, but all, you've got community researchers, right? And that sort of thing. Community members helping out with evaluation. So, from every direction, every space, there's going to be overlap. Thank you, Richard.
And thank you, Daniel, for responding to that. So moving on to our next question from Daniel. They want to know if there's a bibliography of articles that have used these measures. And if so, can they see how they've been used previously?
Okay, so there are a couple ways. There's not a bibliography, strictly speaking. However, there are a couple ways to get at that information, especially in the featured set, which has got probably more questions than anything else. We've got the base set or the compendium, or I'm not sorry, the base set or the group assessment tool. There are citations in that document where you can go find the original source material that inspired the material that went into the featured set. And in addition to that, the compendium itself, which again is where we drew a lot of the material that ended up in the base set, in the grasp tool, and the featured set, that has links where you can investigate that material and how it was originally used.
Thank you. Oh, here's an interesting question about social network methodologies from Yolanda. Are there ways to visually display how organizations work with each other?
There definitely are. I'll tell you what, one of the most inspiring papers that I've read in this space was an S4A paper, right? And maybe this is where this question is coming from, that sort of did a network analysis. If I recall correctly, it was at the county level or something close to that, but basically asked how a bunch of different organizations in that space were linked together and how strong are those relationships. And then that was tied to health outcomes. It was one of the big, yes, it was one of Glenn Mays' pieces. So it's one of the big pieces that sort of shows that there's at least a correlation between the collaboratives. We don't have guidance in the team on specifically how to conduct such a network analysis, but you could conceivably, well, that was based on a certain data set. So linking those data sets is not something that we've really put a whole lot of, I haven't really thought that one through all the way. So I guess the short answer is that's a great question. I'm not sure. I mean, you could definitely do network. I think even, for example, the PHIL, the Phil at PHI has fielded their survey, and they've got all kind of background information. If you use the featured set as a survey, it's got tons of background information where you could conduct a network analysis on the people that have done that survey. I don't know if it could be linked to all county data across America. That'd be a different story, but it could be done certainly with this data if you have like a large number of people, like where you're trying to get a more general number, more trend, what the general tendencies are. I don't know if that's a very satisfying answer. If there's a follow-up, I'll be glad to take it.
Yolanda, if you have any follow-up questions, feel free to, I see that you have a comment here, but if there are any other follow-up questions, feel free to enter that into the Q&A. And then Daniel, I appreciate the shout out to Glenn Mays' paper, and that's something I can share as a part of one of the resources in our follow-up communications. So let's see, I think I saw a couple of questions come in from the chat. So let me make sure that I'm addressing those as well. It's not really a question, rather kind of a comment or feedback, but Rebecca is talking about how it would be great if there were a way to complete assessments online for immediate aggregation when they're gathering to discuss the outcomes or the findings from the surveys. Is there any potential of that happening in the future?
There aren't guarantees, but there is potential. And the fact that that question is being answered makes it much more likely. So thank you so much, Rebecca, for asking that question.
Great. And let's see. David says the purpose of aligning is to produce a different outcome, something that represents the best someone can be, that needs housing, medicine, vaccination, school, et cetera. Is anyone measuring flourishing, which is a shared outcome metric for a collaborative, versus the actions each group says are needed for someone to flourish? And David, I also see that you said Glenn Mays does that in his work, which he does. But Daniel, is there anything you want to add to that or respond to David's question?
I recall getting into flourishing studies back in my days as a graduate student. We do not have any measures on flourishing in the team right now. That's not to say there couldn't be. And again, this is one of those things where if this is something where the field has interest, maybe Team 2.0 has flourishing measures. I would be super interested in hearing more about that for sure.
Great. And then David also has a question about, has anyone figured out how to invest at the community level? The typical result of most collective impact collaborations at the community level, but attribute the benefits to specific people for sharing benefits or savings.
If I heard that correctly, I'm not sure I heard that correctly, but it almost sounded like two questions. Like, has anyone cracked the code on how to do it at the community level? And then how do you like give credit for that? Does that sound about right?
That's how I understand it.
Okay. So the first thing that comes to my mind, one is definitely the featured set has this whole list of questions on community voice. And so I think that would be a thing to check out, see if the items in there resonate. Also, Eliza and I and Karen Minyard and Glenn at the Georgia Health Policy Center have written a paper on community voice in health collaboratives that I would recommend. And maybe if Mariana could find that in Google Scholar, we could possibly, I can maybe find the link. Those are what I would recommend, but I also want to recommend if we could go back on the slides, I think it's maybe one slide. I definitely want to recommend that bottom link. It's something we've been thinking about a lot is, for example, how to get the ARPA funds, the American Rescue Plan Act funds, down to the community level, which is not easy, as you might all right, Glenn Landers at the Georgia Health Policy Center has put a link to our file. Thanks a bunch, Glenn. Our paper on community voice. But I also wanted to recommend that bottom link there for more resources. And of course, by all means, email us too, stay in touch, because we're very interested in that and coming up with all kinds of resources that hopefully will help people do that.
Great, thank you. And I don't see any other questions that have come in. I see a couple of other comments. So I think unless there are any other questions, we can end a couple minutes early and let everyone hop off to their next meeting. But thank you so much for presenting on your work today and for sharing your toolkit. I think it's really, really valuable. And I look forward to see how this progresses moving forward. And I thank you to everyone else who joined us today to listen in and see what's going on at the Georgia Health Policy Center and aligning systems for health. So With that, I hope everyone has a wonderful rest of their day and the rest of their week, and we look forward to seeing you at one of our next Research in Progress webinars.
Thanks so much, everybody.